times. And I want to ensure, again, within and out with government, that drugs policy is joined at the hip with our work in mental health, homelessness, housing, the justice system, education and prevention, how we in this country tackle poverty and inequality, and how we address adverse childhood experiences. Because one of my reflections in coming into this post is that we will not tackle the drugs death crisis by taking a narrow view. This is about systems change, it's about changing our society, and it's about changing our services, and it's about changing our country. And I think our approach reflects, in part actually, what David Best referred to, and this has some resonance with me as a former social worker, that ultimately we have to be focused on jobs, friends, and houses. And when I was much younger, and when I was a prison social worker, much of my time I would be, spend arguing with my boss about the need for more offending behaviour work, need for more CBT, more work on this, that, and the next thing, whatever, the latest research, was saying, in and around offenders. But then I just come to the point, as much as all of that work was important, so were jobs, so were houses, and so were friends, and so were support. And the national mission is about building that whole system of care. A system of care that will have many parts, but has many parts that will have to work together. And people have to have the choices that suits them, and they have to have access to what works for them. And that means that our services will need to change, and some of that process has started. But that's changed not just in terms of organisational structures, it is also about culture. And we do need to stop trying to shoehorn people into services that exist. And what we have to be doing is changing services to meet the needs of individuals. And I am struck by the gaps that still exist. And I mean, it won't surprise people to know that I am often contacted by those who are caring for people who are in crisis. And then when I go and make inquiries either to local services or via my officials, quite often in terms of that out of our support, it's the recovery community that is stepping up to the plate. But we all have a responsibility to step up to the plate, irrespective of which part of the voluntary sector you're in, or whether you're in statutory services, or which tier of government you currently work in. And I want to, as part of our national mission, make rights real. I don't want people's rights just to exist either in rhetoric or in theory. And you will of course hear me talk a lot about MAT standards, about the National Care Service, about the human rights bills that is coming down the line as well. But I know that there are other propositions out there. I know Stephen Wishart will give a presentation later on that very subject. And I'll always consider other propositions fairly based on evidence and not ideology. And my view of evidence is, if I can coin a phrase, is pretty broad church as well. Evidence isn't just about research, it isn't just about what the professionals say. Actually, evidence has to be rooted in real life and in what's happening on the ground. And there's also, I think part of our agenda to make rights real is we are going to have to do more to bolt down people's rights to advocacy and bolt down people's ability to access advocacy services as well. And I think there's a lot we can learn from work that is taking place not just in other countries but in other spheres as well. And it is important that we work together, whether as politicians or whether we're people in the recovery community or service providers. The national mission is of course backed up by £250 million of additional resource. The Auditor General recently acknowledged that there is a 67% increase in funding from 2014-15 to now as a result of the national mission. And he, of course, cast a long eye over funding and action in and around to tackle drug deaths in Scotland. And there is, of course, more work that we can do to follow that money, although I can assure you we have begun very closely to follow that money, and are indeed, working through the layers of this work. There are many things about the National Mission that I could discuss today, but I'm just going to focus a little bit more on residential rehabilitation, because I think our work here demonstrates both the challenges that we all face, but also the opportunities. And I think some of the issues that Alan spoke about in his advocacy work as well. Many of you will be familiar that we are committed to invest in £100 million over the lifetime of this Parliament in residential rehab and aftercare. And that by the time we get to the end of this Parliament, that we will achieve our aim, and we will achieve the increase both in provision and increase in capacity. And we made a very firm commitment to having at least 1,000 publicly funded residential rehab placements per annum, and that the bed count will increase by 50% also. So this is, of course, about using existing capacity better, but it is also about increasing capacity in the system. And we have thus far deployed some different funding routes. Some of that has been direct via the CORA Foundation, and I'm very pleased that we are funding nearly 97 frontline and grassroots organisations directly via CORA from government. But we're also gathering and publishing more information than ever before, and that's about where the beds are, where the facilities are, who has a pathway and who doesn't, what are the waiting times, and where are the waiting times longest, and where are the areas that are doing better in terms of getting people into services that meets their needs. And in terms of the decisions that we have taken thus far, there is a commitment thus far to invest over £20 million, which will add additional beds and capacity. And for me, in this journey, there have been two very special moments, and one was when we announced the National Family Residential Rehabilitation Service to open in Saltcoats this year, and also when we announced last month the new child and mother units that will be operated by Aberlour. And I know that later on in the day that Justine will speak about things from a women's perspective. So for me, our commitments around residential rehabilitation are also about keeping the promise to our children who are looked after or who are at risk of being looked after, because I know that there are women who are dying through the fear of losing their children and therefore not seeking assistance, and that there are women who have died as a result of the trauma of losing their children. And I will defy anyone who says that we shouldn't be investing in residential rehab, or indeed, as David says, that residential rehab doesn't work. And it has often struck me for many years that particularly with folk with maybe more complex needs, that it is often those who would benefit the most for residential rehab that they find it hardest to access rehab, and that is something that I am absolutely determined that we address. We also have a really interesting prison to rehab scheme, something that I wish was available when I was a prison social worker all those many years ago. And I know you'll hear later from Stephen Brown, who has direct experience as a prison navigator. And when I worked in prisons, again, it was a long time ago, I have to concede, but there was work around a prisoner listening service, and that was in and around supporting people with mental health or who were feeling particularly low in mood. And that was a peer-led scheme, and of course at the time there was some suspicion within the SPS about it. But it is important to recognise how things have moved forward in terms of the recognition around peer-led support, and I'm sure that Stephen will make a really valuable contribution to proceedings later on in the day. And I'm also very pleased that there is work going on to develop peer-led approaches, such as work that's currently taking place around police peer navigators, peer-led navigators, and that's building on the work that was undertaken by the Medics Against Violence. And there's an immense amount of work that is beginning to take place within our justice system. I know Natalie from Cisco is spearheading a lot of that. And when I visited Perth Prison a few months back, I used to work in Perth Prison, and it was really good to see the work that was going on around the Recovery Cafe. I want to say a wee bit about, because I know you'll touch upon this later in proceedings, and it's about the Scottish Government's approach and our openness to learning from others. And I know you've got input with regards to UK Government's project at Adderscheme. And I am not defensive about this in any way. There is work that takes place in England, whether it's around the diversion or the recovery aspects of Project Adder, whether it's the work that police commissioners are doing south of the border, whether it's some of the work that Carol Black done for the UK Government, which had a great synergy with the work in Scotland in terms of pulling together the various strands to make folks' lives better, to have a real focus on leadership, and to have a real focus on recovery and investment. There are, of course, things about the UK Government approach that I don't like, but that doesn't mean that we don't look to south of the border to learn lessons where that is important and applicable. But my approach, whether in this current job that I'm in or in other jobs, is always to look at the very best of evidence, whether that's here in Scotland, whether it's in the UK, or whether it's at an international level. And if I can just bring my remarks to a close, because I'm conscious that I'm probably the only thing that's standing between you all and your cup of tea, just to thank David Best for his contribution. He is quite clearly someone who has built a career on being an advocate for hope and change, and I think he has some very wise words around recovery capital, and I'm very familiar and supportive of the work that Clero are undertaking. And it is very refreshing to hear an academic take that wide view of what good evidence is, but also have that wide view, which I share, about who holds the expertise. And we know that the real experts are the folk that are in this room. And my task ahead is to recognise that we have more work to do to ensure that services are sensitive, responsive, but also ambitious, and that we respond in a meaningful way to the trauma that people have endured. But there's also that need to recognise that for people who use drugs, or for people who have used drugs, that actually they have much in common, that we all have much in common, and that we have to focus on the human dignity and the rights that we all have. And I'm always struck by the work of Gabor Mate when he says we have much in common with the people that are ostracised by our society, that society should learn from the people that it excludes and should learn from the people that it ostracises. I know, and I think David Best and others spoke about this, that progress is never linear. It's never linear for individuals. It's never linear for the work that we try to do within and out with government, but we are absolutely determined that we are going to stick with it. And just one final thing, I did promise I would desist so you could all get your cup of tea, but I do just want to thank Rory for his contribution today as well. I'm in favour of safer drug consumption rooms. They're not a silver bullet, but nothing's a silver bullet. I would always be very suspicious of anybody who presents any solution as a silver bullet, but we know from the drug consumption room that opened in New York not that long ago that it's prevented 59 people dying from an overdose in its first 3 weeks. And in all that we do, we have to be about reaching folk where they are and connecting with them in a way that is meaningful to them. We can't be forcing solutions on folk, but we have to go out there, reach out, meet people where they are and absolutely stick with them. So, ladies and gentlemen, thank you very much. As you can see, I'm not a soundbite politician, and I am very gracious and thankful to you all for the opportunity to be here and for listening to my contribution this afternoon. Thank you.